What we found, though, was that there was a very high rate of VGPR and a decent rate of CR, but most importantly, what we found is that when we looked at patients after they'd had a stem cell transplant and looked at their levels of minimal residual disease negativity by next generation sequencing, that there was an acceptably high rate of MRD negativity, at least at a level of 10 to the minus 5. So what we actually found is that 56% of the whole population, and this includes patients in whom we did not have informative sequences that we could do MRD, or where we didn't have a sample, or the patient didn't make it, through the whole treatment, so on an intent to treat basis, 56%. What was very pleasing to us is that when we looked at bone marrow samples from patients after transplant and looked at the level of residual disease by next generation sequencing, that we found that if you take all 18 patients, and not all patients actually ended up having the transplant, and in some patients we didn't have informative sequences where we could do MRD, but on an intent to treat basis, 56% of the patients were negative at a level of detection of 10 to the minus 5, which we believe is promising. And some patients were negative at an even deeper level of 10 to the minus 6. So we believe it's a small study. Don't want to make too much out of the depth of response, but certainly we believe that this is encouraging and matches well with any results that have been presented to date in this setting. Now, what was particularly interesting to me, though, was having had the hypothesis going into this study that our treatment was activating macrophages that could potentially enhance phagocytosis, is that when we took samples from patients on study, so literally 24 hours after starting the first treatment, and looked at their monocyte macrophages ex vivo, we were able to see that there was induction of Fc receptors on the surface of the macrophages, so CD64, which is a receptor that allows the macrophages to bind the monoclonal antibody, the Daratumumab, and thereby potentially enhancing phagocytosis. But what we also saw, which was quite interesting and which went along with this story very nicely, is that on the multiple myeloma cells from the patients, there was a significant downregulation in CD47, which is referred to as a don't eat me antigen. So this combination together would suggest that in patients after initiation of treatment, that there is in fact enhanced potential for phagocytosis, which may ultimately feed into a better response using this regimen.